Hello, my name is Natalia. Today I'm going to show you what is the method of putting in and removing a catheter. So let's go to the video. So guys, this is the method of inserting a catheter for a female. First thing you have to do is to gather the equipments as shown in the video or the demonstration. You have to make your patient knowledgeable that you are gonna remove the patient's catheter and insert a new one, or you are gonna insert a new catheter. So everything has to be under very sterilized conditions. So your gloves, your sheets, spreadsheets, and everything you have to use in the sterilized way. So I'm using the bed pad like thing under the legs of the patient. You can see the patient is in a position with wide legs. So for females, this position is known as the wide leg standing position is known as lithotomy. And after you put on the gloves and take the sheets out, and next you have to put on your surgical gloves, which are very sterile. Previously, just to put on the sheet, you used some sort of gloves which is not much sterile, but now you're using sterile gloves from the packaging. And then you're going to use a sheet just under the perineum of the patient. So that everything that you are washing is coming onto that sheet. And then you can see this sheet with a hole that you can easily position on the urinal area of the female patient. This comes with the packaging. You have to then sanitize well your hands and put the catheter now. So you're removing the things from the catheter packaging, and now you're gonna lubricate. This is a Foley catheter you're using. Then you have to lubricate one end of the catheter, and then make the patient knowledgeable that you're gonna feel some pressure. I'm gonna put you this catheter. So first of all, you have to clean the area of the urinary area. So for that, you can see cotton swabs are used. You have to clean it from front to back. Front to back, you're cleaning it. And then you're inserting the catheter. First you have to lubricate, as I mentioned previously. You can understand that you are in a correct track when the urine starts to flow out. So you have to inflate the bulb of the Foley catheter by pressing the syringe, and by pulling it a little back, you can feel the tension that it says that the balloon is inflated, and then you have to keep the bag downwards so that it is easy according to the gravity to collect the urine. And now you can discard the sheets and everything you used for this procedure as shown. You have to replace this bottle, the urine bottle. So when replacing the urine bottle, you have to first put on gloves and have your hands well sanitized, and then you have to take the urine bottle and and you have to just lock the input here, and then remove the connection, and then you have to empty it and then clean it and connect it again and unlock the and fix it and unlock the bottle.
Something else? The person who has nephrostomia or epicystostomy, what else should you monitor in them? So you're looking for what's this? Each day, once or twice a day, you look at the what's this? So you're looking for what's this? Each day, once or twice a day, you look at the what's this? Skin, what are you looking for?
Redness, inflammation in the skin.
Should one happen, what do you do?
You have to apply antiseptics like hydrogen peroxide.
Хорошо. And clean this area thoroughly, да, Steve? Inflammation will subside in 1 or 2 days if you do everything right. If you characteristics, what you are looking at students for? Not
So,
only do you register the volume, does students? What else?
you have to
What does
check
color
the
tell
color.
you?
If the urine is having a pale yellow color, that means he is having normal, and if it's like watery, he is overhydrated, and if it's like a reddish color or like very brick red color, that means he's having some sort of infection or bleeding, sometimes maybe.
Hematuria,
Yeah. And so if he's dehydrated, the color of the urine would be dark yellow.
Agree, students? I think everyone saw after physical exercises the color turns what students? Very brownish, yellowish, and light when the patient is correct.
And you have to consider about the urine output. So if the urine output is very high, that means normally his body weight is 60, and so when you multiply it by 35, his intake should be 2 liters approximately. So the output should also be 2 liters, right? So if the output is less than 2 liters, that means he's taking less amount of fluids. If it's more than 2 liters, he's taking more amount of fluids.
Значит, mixing up the numbers of output. Output has to be normal, what students? It has to match per hour, what number? Not intake.
Total output.
What is the normal urine output? See the line.
70.
For what weight?
70 kg.
70 kg. He's 60.
61.
So each hour has to be
60.
You must know this number, понятно? So you jump from not 70, but from the actual needed for you, for instance, 50. For him, maybe там 80, да, students? Там for another it is 100. All depends. For the infant, even different, да, students? Because they have different body weight, понятно? Вот, идеально. Clear? Keeping the bottle above the patient is what, students? Wrong, да? You always have to keep
Below.
so you kneel down